I do want to be mindful of everyone's time, so I'm going to go ahead and get started. For those of you who don't know me, my name is Kristen Osterhout. I am the Education and Training Coordinator for the Alzheimer's Disease Caregiver Support Initiative. We have a grant from the New York State Department of Health to provide services for caregivers of anyone living with any form of dementia or memory loss. We cover 6 counties. They are Clinton, Franklin, Essex, Warren, Washington, and Hamilton counties in northeastern New York. And we do that through 5 areas of service. You start with care consultations, where you meet one-on-one with our caregiver or with our care navigators, and they meet you wherever you're most comfortable, whether that be in your home, in our office, or somewhere out in the community. Then I do the education and training, like the webinars that I've been doing the past few weeks. I also do the memory cafes, which are social events for caregivers and their loved ones. And I do support groups. Right now, support groups are happening and memory cafes are happening virtually, but we are going to start to offer 2 support groups in person in October. So that's very exciting for people who are comfortable and would like to meet in person again, following some health and safety protocols. Now we also offer something called Project Lifesaver, which is a bracelet that your loved one would wear if they're at risk for wandering. We would be able to help locate them very quickly and easily if they were to be missing. And we also offer respite. So we will pay for caregivers to get a little bit of a break. So that's me and my program. I also want to let you all know that you are in a listen only mode right now, which means I cannot see or hear you, but if you have questions, please type them into the chat box and I will answer them either throughout the presentation, if it's natural, or at the end. So I'm going to go ahead and get started. And today's presentation is health and hygiene for caregivers. And I'm going to start by talking about health. So what is health or wellness? I feel like we hear these terms a lot. And this is the definition that I'm going to be using in this presentation. It's from the International Council of Active Aging. And they have these dimensions of wellness, which include intellectual, physical, social, spiritual, vocational, emotional, and environmental. I really like this quote as well. It's on the screen. And as caregivers, it's really important to consider the health and wellness of yourself and the person that you're caring for. A lot of times caregivers will focus on the person they're caring for. They will forget about their own health and wellness. And you need to take care of yourself in order to be able to take care of your loved one. So for physical health, that would include things like healthy eating, exercise, sleep, managing stress, which is so important if you're a caregiver, limiting alcohol, not smoking, and going to your regular doctor's appointments and following the medical recommendations of your doctor. Emotional health would include coping with challenges and behaving in respectful ways that signify emotional wellness. So it might include peer counseling, attending a support group, stress management, and laughter. I think that's one of the most important things, is to use humor. You have to laugh. Social interactions are valuable for maintaining health too. So spend time with friends and family or neighbors, and join clubs, travel when it's possible, and or volunteer. And making like exercise a social activity can be really beneficial for both a caregiver and a person living with dementia. I love that these 2 couples are playing tennis here. It's a fun way to get out, to spend time with friends, and to do something that will improve your health. Intellectual and cognitive health. So that would include engaging in creative and intellectually stimulating activities. And it would include taking classes, journaling, artistic hobbies like painting or joining a theater company, games and puzzles, anything that makes you think. No, I don't know what happened to my slide here. Let me fix that picture. Sorry about that. So professional and vocational. Be work that utilizes a person's skills and creates personal satisfaction that include both paid and unpaid work. So volunteering would count, prove skills, helps others, caregiving, teaching, mentoring, and vocational hobbies. Everyone wants to feel like they're contributing in some way. So whether that be to their community or to their home by doing chores around the house and yard work, things like that, is valuable to a person's overall health. Their spiritual health, so living with meaning and guided by personal values, and that can increase feelings of well-being, would include connecting with a religious community, but it doesn't have to be. It could be a personal meditation, mindfulness exercises, or yoga and Tai Chi, and even just spending time in nature. And then environmental health would include respecting the Earth's resources, reduce, reuse, recycle, spending time in natural areas, walking trails, or gardening. So here are some practical tips for health. In terms of healthy eating, have a variety of healthy foods available in the home. Give choices. So maybe if you buy a variety of fruits and vegetables, ask your loved one, do they want the cooked carrots or the broccoli? Maintain familiar routines, so eating regularly at the same time, prepping your food. It's a great idea when you come home from the grocery store to wash and cut up any of your fruits and vegetables, and prioritize safety, making sure that you're going through your cabinets, getting rid of any items that have expired, or if your loved one lives alone, going through their items, just to make sure that food's being stored at safe temperatures and that they, are not consuming any expired foods. Physical activity, like I said before, you can exercise with a friend, make it a social activity, especially for someone living with dementia. That can really encourage them to get moving. And try a variety of different activities. Watch exercise videos on YouTube that are made for older adults, like chair yoga. You could go for a walk, dance, use resistance bands, lift weights, or use household items like soup cans. You can even doing simple household chores like sweeping, dusting, vacuuming, yard work. Those are all ways that you can exercise around the house. Be sure to wear comfortable clothes that you can move around in and stay hydrated, especially if you're caring for someone. A lot of times as we age, our sense of thirst kind of fades away. So making sure you're drinking plenty of water, and be realistic about how much activity can be done at one time. Mini workouts, like doing 3 10-minute workouts rather than 1 30-minute workout, might be a better idea. Another aspect of our health would be doctor's appointments, visiting the doctor regularly. And we want to plan for our doctor's appointment. So make a list of questions or concerns you may have. And if you're a caregiver, include the person that you're caring for in the planning as well. See if they have questions or concerns that they want to talk to their doctor about. Ask them, bring a list of all of the medications that you or your loved one is currently taking. Be sure to include over-the-counter medications as well, the dosage, how often medications are taken. This is especially important if your loved one or you is seeing more than one doctor. You got to update all the specialists and that sort of thing. It can be very easy as the caregiver to talk to the doctor for your loved one, answer all of the doctor's questions, but if possible, or however possible it is, should try to allow your loved one to answer questions and respect their privacy. Leave the room if necessary, just to give them a little bit of space. You can always talk to the doctor privately after. If you live out of town, talk to the doctor about how to stay up to date on your loved one's health. Ask about community resources. In some practices, this may mean talking to the doctor, but other places they may have a social worker on staff that you can ask questions about community resources of. It's also important to realize that a lot of times people do not, people have to go to the hospital at some point in their lives. So when a hospital stay is coming up, if it's planned, you can do some things ahead of time to make it go a little more smoother. Think about if hospitalization is the right step. Speak to your physician to discuss what options are available and what would be appropriate for you or your loved one, depending on who needs care. Could the procedure be done outpatient? If not, can any of the tests be done ahead of time so that that reduces the amount of time that you're in the hospital? Have a care team to help you through it. Don't try to do the whole process on your own. So have friends and family members help out. Find out what kind of anesthesia there will be. General anesthesia can have side effects, so local anesthesia might be a better option if possible. And talk to your doctor about that. Make sure that regular medications will be continued. And find out if possible, could you get your own private room? Will the insurance companies even cover it? A private room can be much calmer and less confusing for a person living with dementia. Again, involve your loved one in the planning process as much as possible. Don't talk about the hospital stay in front of them like they weren't there in the room. And shortly before leaving your home, tell your loved one that they are going to be spending a short time in the hospital. Emergencies you can't always plan for, but it's a good idea to have a plan in place so that in an emergency, it will go smoother. So identify a friend or a family member that you might be able to bring with you. That way someone can comfort your loved one and talk to them while you are talking to the doctor or vice versa. Be ready to answer hospital staff questions. A lot of times, the staff doesn't always have a ton of experience working with individuals living with dementia. So you might have to answer the same questions or help them understand the dementia, talk to them, make sure they understand, why your loved one might be confused or agitated, and kind of explain, their memory issues and their language issues and that sort of thing, and give them an idea of the best way to talk to your loved one and give them tips of things that work well for you in that situation. Comfort the person, maybe bring a comfort object like a blanket or their favorite sweater or something along with you that they can hold or touch to be comforted. Be patient. A lot of times tests take time, emergency rooms, they move kind of slowly, they have a lot of people, they have to triage, so it may take time. And do not leave the emergency room without a plan in place for returning home. The hospital stay will likely be a very confusing, stressful time for the primary caregiver and the person living with dementia. So you're going to have to help your loved one use the bathroom, fill out meal requests, remember to drink water. They will have difficulty finding the call button or the bathroom, may need adjustments. So communicate with them in a way that they will understand, slow down, and be there to advocate for your loved one. Take breaks if possible. That's why this care team really comes into place, so that you're not alone with your loved one. And I know right now with COVID, hospital policies keep changing. But make sure that you're advocating for your loved one in whatever way possible. Might also be helpful to have an emergency bag already packed with your health insurance cards, list of medication, list of doctors, healthcare advanced directives, snacks, water, depends, any kind of comfort object, toiletries, change of clothes, your own personal medications if you're the caregiver, pain medications. The worst thing would be to get there and have a headache and not have any Tylenol. Paper and pen for you to take notes on, and some cash in case you want to go buy a snack or something like that from a vending machine. All right, so let me check before we switch to hygiene tips, let me check the chat box and see if there are any questions. Doesn't seem like it. So I am going to move on to hygiene tips for caregivers. Maybe the slide will go. So for general hygiene, want to keep in mind that the person with dementia may forget how to comb their hair, clip their fingernails, or shave. They might forget what the purpose of certain personal care items are, like the nail clippers or the comb. They're not doing it on purpose. So some ways to handle that are continuing routines from the past. The person's always gone to the beauty shop or a barber, continue that activity. If the experience does become distressing, maybe there's too many people around, it's confusing, see if you could have someone come into the home to do that for you. Use their favorite toiletries. Maybe they have a certain scent that they like to use, or soap, toothpaste, shaving cream, cologne, or makeup. Think about if they used to take baths or showers in the morning or in the evening, and try to follow those routines as much as possible. It can be helpful to model how to complete tasks. So comb your hair next to them and then expect them to comb their hair too, and encourage them to copy your motions. And keep safety in mind. Consider using simpler or safer grooming tools like cardboard nail files instead of the metal ones, or electric shavers can be less threatening than clippers and razors. Incontinence is a big topic, it's very common when we're talking about someone living with dementia. So if incontinence is a new problem, consult the doctor and rule out potential causes such as a UTI or weak pelvic floor muscles or medications that your loved one is taking. Consider medical conditions, common side effects from medications, and obstacles that may be causing or contributing to the problem. Some common medications that can cause incontinence include UTI meds, constipation or prostate problems, diabetes, stroke, or muscular disorders such as Parkinson's disease, or physical disabilities that prevent the person from reaching the bathroom in time. And many other products can increase urinary frequency, like diuretic drinks like coffee, tea, and soda. Sleeping pills and anxiety reducing drugs that may relax the bladder muscles can also cause incontinence. And maybe your loved one can't find the bathroom in time, or there are obstacles in the way that prevent them from getting to the bathroom in time, like furniture, clutter, clothing. It's difficult to unbutton and remove. And so by determining some of these possible causes, if there is some kind of treatment that's available or some change you can make to find a strategy that will help. If that's not the case, that's okay too. You still want, no matter what, to respond supportively and preserve dignity. That's very important. Reassure the person and reduce feelings of embarrassment. For example, maybe you respond by saying, anyone can have an accident, instead of saying like you wet yourself or something like that. Be very matter of fact, don't scold or make the person feel guilty. Use adult words rather than baby talk or referring to using the toilet, and respect their need for privacy as much as possible. Do not withhold fluids. This can cause dehydration, which can lead to UTIs, increased incontinence, and agitated behavior. You may want to consider limiting them before bed, but that's the only time. And communication's key. Encourage the person to tell you when he or she needs to use the toilet. Watch for nonverbal cues such as tugging on clothing, restlessness, making unusual sounds or faces, pacing, sudden silence, or hiding in corners or behind furniture. These cues may indicate that they need to use the toilet. And learn the person's trigger words or phrases for needing to use the toilet. The person may use words that have nothing to do with toileting. For example, I've heard someone say, I can't find the light. Where's the light? I can't find the light. But to that person, that means I can't find the bathroom, or I need to use the bathroom. Communication challenges often increase in the later stages of dementia. Make it easy to find the toilet. Clear the path to the bathroom by moving furniture. Keep the bathroom door open so the toilet is visible, and make the bathroom stand out. For example, place a brightly colored rug on the bathroom floor, or lid colors, or post a sign on the door for the bathroom. Make the toilet safe and easy to use. Raise the toilet seat, install grab bars on both sides, and use night lights to illuminate the bedroom and bathroom. And consider using a portable commode or urinal for the bedroom just in case of nighttime accidents. Remove plants, waste baskets, or other objects that could be mistaken for a toilet, and remove any throw rugs that could cause the person to trip and fall. Create a routine for toilet use. For example, help to the person to the bathroom first thing in the morning, every 2 hours during the day, immediately after meals, and just before bedtime, and remind the person to use the bathroom just before his or her usual time. You can give the person plenty of time in the bathroom to empty his or her bladder or bowels. You may want to run water in the sink or give the person a drink of water to stimulate urination. Afterwards, check the toilet to see if the person has actually urinated and or moved his or her bowels. And consider clothing and incontinence products. So choose clothing that's easy to remove and easy to clean. Consider using incontinence products such as waterproof mattress covers, incontinence pads on the person's bed, or on chairs where they're sitting, padded undergarments, or adult briefs. I often hear from caregivers that bathing is one of the most challenging personal care tasks. It's a very personal experience. It can be quite awkward for some people with Alzheimer's and other dementias. They might perceive it as being unpleasant or intrusive, which leads to a lot of difficult behaviors around bathing. A lot of people with dementia will be resistant to bathing. The person may no longer remember what bathing is for, or doesn't have the patience to endure, lack of modesty, being cold, and other discomforts. Loss of independence and privacy can be very difficult for the person with dementia. The disease may also increase sensitivity to water temperature and pressure. So do not take disruptive behaviors personally. Remain flexible, patient, and calm. Have calming activities ready in case the person becomes agitated. For example, play soothing music or sing together. If the person resists bathing, distract them, redirect them, and try again later. Establish a bathing routine, keeping in mind the person's preferences. Do they like to take showers or baths? Do they always take showers in the morning or at night? This can help eliminate some of the difficult behaviors. Be prepared and keep safety in mind. Gather all of the necessary supplies, including towels large enough to completely wrap the person for privacy and warmth, shampoo and soap ready and within reach before you tell the person that it's time to bathe. Install safety equipment in the bathroom, including grab bars, place non-skid mats on the floors, use a tub, bench, or bath chair that can be adjusted for different heights. Watch for puddles and slipping hazards. Also take care to never leave the person with dementia alone in the bathroom. Use products made out of non-breakable materials and keep sharp objects like tweezers and scissors out of reach. The person may not sense when water is dangerously hot or may resist bathing if the water is too cool. So always check the water temperature even if the person draws his or her own bath. Lower the thermostat on your hot water heater to prevent scalding injuries. Pad the shower seat or any other cold and uncomfortable surfaces with towels, and check that the room temperature is pleasant. Help the person living with dementia remain as independent as possible. So when a person's living with dementia, allow them to do as much as it's possible on their own as they can. Be ready to assist them when needed, but try to only offer the level of help that is necessary for them to complete the task. As the disease progresses, he or she will require more assistance. Give the person choices. Do you prefer to bathe now or in 15 minutes? Be sure the person has a role, even if it's just holding the washcloth or the shampoo bottle. Keep them involved. Coach the person through each step. For example, put your feet in the tub, sit down, here's the soap, wash your arm. Use other cues to remind the person what to do. Try using a watch me technique or lead by example. Put your hand over the person's hand, gently guiding their actions. Make adaptations as needed. You may experience the most difficulty when attempting to wash the person's hair. Try using a washcloth to soap and rinse the hair in the sink to reduce the amount of water in a person's face. Or you could sew pockets into the washcloths to help the person hold the soap. Be gentle. Their skin may be very delicate and sensitive. Avoid scrubbing. Check the spray on the shower head to make sure the water pressure isn't too intense. And be sure to clean hard to reach areas. Wash between folds of skin and under the breasts. It's important that the genital areas are well cleaned, especially if incontinence is a problem. Sponge baths with a washcloth can be effective between showers. Consider using non-rinse soap products between showers, which can be used with warm towels and applied under the guise of providing a massage. Protect the person's dignity and privacy. Try to help the person feel less vulnerable by covering the person with a bath blanket while undressing. Let the person hold a towel in front of his or her body in and out of the shower or tub to help ease anxiety. Have a familiar person of the same sex if that's more comfortable. Cover and remove mirrors if the reflection leads the person to believe that there's a stranger in the room or if they're just uncomfortable. And I do have this video that I would like to show you from Teepa Snow. Oh, there we go. Just want to make sure the sound's up. There we go. Oh, sorry about that.
I'm going to get on the, are you right-handed? Yes. I need to be on the dominant side of the individual because that's where they have motor memory for doing all kinds of tasks. They don't know how to use their other hand nearly as well. So what I'm going to do is I'm going to get on this side. Now, hold hands like you normally hold hands. Shake hands like you normally shake hands. Go ahead and shake somebody's hand. And realize there's nothing real comfortable about that. I mean, once you shake hands, then it's like, okay, let go. And what we can end up with is a tug of war. Or late in the disease, people with dementia often like a lot of contact and they'll squeeze you and actually hurt you. And it's like, ow, 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 ow. And where are you going to grab to get them loose? On the wrist. And what you're going to do is bruise them again. Shake hands, but then immediately slide up around so that what you're doing is holding on palm to palm, thumb to thumb, and you've got a lot of palm contact. Try that with your partner. And then turn it so their hand is on top of yours and just relax the hand so that it's very clear it's relaxed. What you're doing is you're putting pressure in the palm, and pressure in a human being's palm calms them down. So what you're actually doing is helping to calm them even while we're doing things because I'm giving them input into the sensory system. Okay. The other thing that I can do is take the other hand and lay it on top of the hand. And what I'm creating is artificial warmth.
Sorry about that.
Yeah. Now, that's a little less distressing because she understood what I was doing by being to the side and having a single person in the room. And I'm not being loud, I'm not being noisy. What else do you think we need to think about doing in the room? given that she doesn't have any insulation and I'm about to have her come out of her shirt. Get it really warm. Who's going to need to be sweating? Me. I need to be hot so that when she comes out of her shirt, she's not uncomfortable. Because if she is uncomfortable, is she going to want to take more clothing off? No, because she's cold. Here's the next thing we're going to do. I'm going to take a warm towel fresh out of the dryer and drape it around her shoulders. Now, when I do that, what happens to her exposure in the front? She's covered, she's modest, but what can also happen, she's warmer. Then what I can do is wet her through the towel. I don't even need to take the bra or the underthings off yet. Let her keep some modesty, because once you get your clothing wet, what do you think most people want to do? Take it off. And if I haven't had a battle up to now it makes sense to take those off. Okay? Here's the other place I want to put a towel. Across the lap. Why? That's the other modest place. And that's another place that's real sensitive.
So I personally love Tipus Now. I think she is a wonderful resource if you're looking for more information about anything related to caregiving or dementia. I would highly recommend checking out her YouTube videos. I thought she had some really great tips. So as far as clothing goes, when you're planning on getting someone dressed, plan plenty of time when dressing or grooming. Rushing the person can cause anxiety and frustration. As the disease progresses beyond the early stages, try choosing and putting on clothes can be frustrating for the person living with dementia. They may not remember how to dress or might be overwhelmed with the choices that they have in their closet or the task themselves. They might not be picking out appropriate clothing for the season. So limit the options. Remove extra clothing from closets as it can be overwhelming for a person with dementia. Give the person just two choices. Say, do you want to wear your red shirt or your blue shirt today? Pick comfortable, simple clothing. Shirts that button in front and cardigans and blouses are easier to work with than pullover tops. If buttons and zippers are too difficult, you could replace them with Velcro. Choose loose fitting items that are soft and stretchy, and as often these are the most comfortable, and make sure that the person has comfortable non-slip shoes. Now, if a person only wants to wear certain garments, which I have heard in the past, they only want to wear these 3 dresses, buy them in every color, buy multiples of those dresses. That way you can wash some and still have some clean. Prepare ahead of time, lay out clothing in the order that each item should go on. Give the person one item at a time while giving them simple, direct instructions like put your arms in the hole, put your head through the hole, rather than just saying, get dressed. Be flexible to reduce arguments. So it's common for them to want to wear something that's mismatched or something like that. Try to focus on the fact that they're in clean clothes, they're dressed, rather than what they actually look like. Choose your battles carefully. The most important thing is for the individual to maintain good hygiene, including wearing clean undergarments. Poor hygiene may lead to UTIs and other infections that could complicate care. And it's all right if the person wants to wear several layers of clothing. Just make sure he or she doesn't get overheated. When outdoors, make sure the person's appropriately dressed for the weather. In the later stages of dementia, the person may forget how to brush his or her teeth. What's important or forget why it's important. So as a caregiver, you may have to assist because proper oral care is really necessary for preventing eating difficulties, digestive problems, and infections. So find a dentist that has experience working with people with dementia or elderly patients. You can contact your local dental association or dental society to find the names of these professionals. Give the dentist a list of all healthcare providers who are caring for the person living with dementia, as well as a list of all medications that they're currently taking. Certain medications can contribute to dry mouth or other oral health issues. That's why it's important for your dentist to know. And keep up with regular dentist visits for as long as possible to prevent tooth decay, gum problems, pain, and infection. In the early stages of Alzheimer's, dental care focuses on prevention. The person you're caring for may simply need reminders to brush their teeth twice a day or to floss and get regular checkups. This will prevent the need for extensive procedures later on. During the middle and late stages of Alzheimer's, the person may forget what to do with the toothpaste or toothbrush or how to rinse. They might be resistant to getting help from others. So look out for indicators of mouth pain or ill-fitting dentures, including loss of appetite. A person with Alzheimer's may no longer be able to communicate these issues with you. Give clear instructions and explain dental care by breaking down the directions into steps. Brush your teeth might be too vague. Instead, walk the person through the process. So here's your toothbrush, hold it, put toothpaste on it, then brush your teeth, or use the watch me technique where you brush your teeth next to the person who's brushing their teeth. Could also put your hand over their hand and help guide them while they're brushing their teeth. Make sure you brush their entire mouth at least twice a day, with the last brushing after the evening meal and any nighttime liquid medications. Allow plenty of time and find a comfortable position. You must do the brushing yourself. Gently place the toothbrush in the person's mouth at a 45-degree angle so you can massage gum tissue as you clean the teeth. If the person wears dentures, rinse them well with plain water after meals and brush them daily to remove food particles. Each night, remove them and soak in cleanser or mouthwash. Then use a soft toothbrush or moistened gauze pad to clean the gums, tongue, and other soft mouth tissues. Floss regularly. Most dentists recommend flossing daily, once daily. If floss is distressing for the person with Alzheimer's, try using a Proxa brush to clean between teeth instead. And experiment with different types of toothbrushes. For some, a soft bristled children's toothbrush works better than a hard bristled adult toothbrush, or one with a long handled or angled brush may be easier to use than a standard toothbrush. Experiment until you find the best choice. A lot of times people with dementia do get confused with electronic toothbrushes or other dental appliances. So it might be best to stay away from those. That brings me to the end of my presentation. I apologize for some of the technical difficulties. Does anyone have any questions? Well, if you think of any questions, please feel free to reach out to me. Next week, we will be doing another presentation on Monday evening, and it's one of my favorite ones. It's caregiver quality of life and self-care. So I hope to see you all at that presentation. Thank you, everyone.